I'm Chu Guan from the Periodontics Unit at National Dental Centre, Singapore. I'll be sharing more about two types of gum surgeries commonly performed here: crown lengthening surgery and open flap debridement. Crown lengthening is a minor gum surgery done under local anesthesia. Excess gums and bone around your tooth are reshaped to expose more of the natural tooth. This procedure is usually done to expose more of your tooth so that a crown fits better. Sometimes, crown lengthening is also done to create longer, more natural-looking teeth for patients whose front teeth appear too short. And for patients who have an uneven gum line at the front teeth, this surgery can create a more pleasing and even gum line. First, excess gums are removed and the remaining gums are gently raised away from the bone. Following which, minor bone adjustment is done to create healthy bone contours. Lastly, the gums are replaced and stitched back together. A dressing may be placed to help control bleeding and help keep the gums in the new position. This allows the crown to be placed onto the tooth. There may be slight oozing of blood from the wound, and you may experience mild soreness after the numbness wears off. Do expect some shrinkage of the gums and slightly larger gaps between the teeth where the surgery was done. This may cause some food trap and temporary sensitivity. The use of an interdental toothbrush will help to keep the area clean, while the use of a desensitizing toothpaste may help reduce sensitivity. The treatment for your crown can commence 4 to 6 weeks after the surgery. Open flap debridement is a minor gum surgery done under local anesthesia. It gives your gum specialist better access to clean the unhealthy root surfaces of your teeth. In severe cases of gum disease, deep cleaning alone may not fully resolve the gum inflammation. Without surgery, persistent inflammation can result in worsening of the gum condition and eventual tooth loss. In such situations, open flap debridement is performed to improve access for cleaning the unhealthy root surfaces of the affected teeth. If the situation allows, bone grafting may be performed to grow back some of the lost supporting tissues. First, the gums are gently raised away from the bone to expose the unhealthy root surfaces. The root surfaces are cleaned thoroughly. Minor bone adjustments may be done to smoothen out uneven contours. If suitable, bone grafts and/or other biomaterials may be placed in an attempt to regain some of the lost supporting tissues around the tooth. Lastly, the gums are replaced and stitched together. There may be mild oozing from the surgical site, and you may experience mild soreness and swelling. Do expect some shrinkage of the gums and slightly larger gaps between the teeth. If bone grafting was done, you may notice a few loose bone granules coming out from the wound. These granules are safe if accidentally ingested. Carefully follow the post-operative instructions given to you by a gum specialist after the procedure. For example, it is important not to eat on the side of the surgery, nor to brush the teeth in the surgical area for a certain period of time after the surgery. Maintain good oral hygiene and keep to your follow-up appointments. Do not smoke, and ensure that any other medical conditions, if present, example diabetes, are kept under control. As we have seen, these two types of gum surgeries accomplish different outcomes tailored to individual needs. Remember, consult with your dentist to determine the best option for you, because when it comes to your smile, every decision matters.